Right now, you'll hear this, that food in particular, food insecurity, it's a significant issue. It's an issue that all of us clearly have some desire to learn about and want to make an impact around. But at the same time, it's an issue that is very present. And I hope that you have that chance to understand how you can make a bigger difference right now. So with that, again, wanted to welcome you, and I'm going to pass it over to Maggie to kick us off.
Thank you, Chris. It is great to be here with you all this morning. Thank you so much for joining us and being interested in learning more about a complex and difficult issue, but one that we have brought some great organizations, great individuals in to help us learn more about food insecurity. So I wanted to run through a little bit of what our day is going to be, our time together, and then we'll dig in. So this morning, we're going to spend most of our time in this big group. I'm going to do a little bit of context sharing because this is an issue that's complex and there's a lot of players really working really hard to address hunger and food insecurity in our state. And so want to give a little bit of some context on the issue before we dive in with our panelists. And then if you are able, from 11 to 11:30, there is some optional time where we're going to do some small group discussions with you as donors and us as Minneapolis staff philanthropic advisors, really to continue the conversation, to hear why this is an important issue for you and what things you're still looking to learn. So if you're able to join us, we'll do that at the end of our time. So when each of you registered, one of the things that we asked is, where are you in your own learning around food insecurity? And then we also asked, what are you looking to learn? And so these are the things that we heard from you. These are the things that we will hit on some of these topics, and there will probably be some that we don't hit on today. But your feedback and your input will help us continue to shape the things that we can bring to you, the things that we hope to be able to connect you to, and the organizations doing the work. So thank you for your thoughts. Thank you for your interest. And we hope that we hit on a good deal of these different areas, things like post-pandemic issue update, the best ways to reduce food insecurity, just a basic understanding. How can I understand who the players are in the organizations doing the work today? So we will touch on some of those and in our conversation. So just to get us started, like I said, before I hand it over to our amazing panelists to share a little bit more about them and their organizations, I wanted to do a little bit of just setting the stage for us. Knowing food insecurity is such a complex issue. And one of the things that I know for myself personally, language is important, right? When we're talking about some of these key terms that are a part of the discussion, let's just all ground a little bit on what some of those key terms mean. So when we talk about food insecurity, we're really talking, we're going to be talking about a household level condition that is about limited or uncertain access to adequate food. Okay. Another key term that you'll hear is food desert. And this is really about really looking at in a given location where there's 33% of the population that in urban areas live more than a mile, and in rural areas live more than 10 miles from the nearest supermarket, supercenter, grocery store. Okay, food desert is a term that you'll hear or hear in headlines if you don't hear today and hear us talk about. Food recovery. So this is one of the things of how our organizations looking at how they're preventing or diverting food waste and really connecting that food waste, recovering that so that it can get in the hands of people who are food insecure. And so food recovery is a term that we wanted to make sure that we sort of ground on. And then the next two, really just a clarifier, right? What is a food bank and what is a food shelf? A food bank is really, it's a nonprofit that sources, stores, distributes millions of pounds of food really into the community to food shelves and food programs. And it's then food shelves or food pantries that are connecting food insecure individuals and families in local communities with food. And so we are lucky in our conversation today to have organizations that play a variety of different roles in addressing and sort of leaning into some of these key roles and key terms. Before we get started, I also wanted to just talk a little bit about the scope of the issue. So we're going to start at sort of a national view, and then we'll start talking more about what does this look like in Minnesota. So from a US standpoint, 34 million people in the US are food insecure. And that was 2021, and that's about 10% of the population. 38% of all food goes unsold or uneaten each year, which is equal to about 149 billion meals annually. So this idea of food waste, food recovery, it is a part of how do we think about this as an opportunity, right? 49 million people in 2022 turned to food shelves, one of the highest numbers, and we'll see this in a stat in Minnesota. It is a significant number of visits that are happening every month, and it's on the increase. And so we'll keep talking about why and what that looks like. In the US, 1 in 3 people that are facing hunger are unlikely to qualify for SNAP or other food programs. And so they're turning to food shelves and other programs for support. And I know for myself personally, this is one of those things where you think, wow, so there are 1 in 3 people that are food insecure that are facing hunger, don't qualify for federal benefits. And so they're really, a part of this group that is living paycheck to paycheck, 60% of Americans. And so this is a challenge. And food insecurity rates, similar to a lot of issues that we face in our country, have significant racial disparities. So for Black individuals, food insecurity rate in the US is 19.7, Latinx is 16.6, compared to white individuals at 6.7. So 2.5 to 3 times higher in terms of rate of insecurity. So that's our national landscape, right? And here we are really looking at what does that look like in Minnesota? What does that look like in our local communities? Here in Minnesota, 1 in 6 Minnesotans faced food insecurity in 2021. 62% of the food that Minnesotans throw out could be eaten or donated each year. So again, thinking about solutions in different ways at this challenge. 5.5 million visits last year to food pantries, with nearly 1 in 4 Minnesotans saying that they use charitable food support in the past year. And that number goes even higher when you start to dig into some other views that our panelists or other realities that our panelists will talk a little bit more about. Similar to the national number, a little bit less, but 32% of Minnesotans that are facing hunger are unlikely to qualify for federal programs and support. And in Minnesota, those national racial disparities persist, and they even increase for Minnesotans. So our white population that are facing food insecurity is a little lower than the national, and our Black population that's facing food insecurity is higher. So you see that 25% for Black Minnesotans compared to 5% for white Minnesotans. So with that, I wanted to, again, just do a little bit of some sort of stage setting. And now I'm super, super excited and grateful for our panelists who are here. John Blamo from CAPI, Zach Rodvold from Second Harvest Heartland, and Ann Hill from Twin Cities Food Justice. I am going to turn it over to each of them to let them share a little bit more about their organization, the work they're doing, and themselves and their work. So, John, I'm going to let you start us off.
Thank you, Maggie. Good morning, everybody. My name is John Blamo Jr. I'm the Director of Basic Need here at CAPI. First of all, I want to express our thanks and appreciation to the Minneapolis Foundation for allowing us to be part of this discussion today. A little bit of history. CAPI was actually established in 1982 as the Center for Asian and Pacific Islanders. The organization was established to help resettle immigrants coming to the U.S. after the Vietnam War. Over the next 2 decades or more, their mission was expanded, and in 2008, the name was actually changed to CAPI USA to reflect its multicultural focus. So they are now called CAPI USA. We have 2 locations, one in Brooklyn Center and another in South Minneapolis on Lake Street. We have 4 pillars of service: public policy, civic engagement, economic empowerment, refugee services, and basic need. As the basic need director here at CAPI, I oversee the food shelf. I also oversee our benefit enrollment center, and I also oversee our community health services. Some basic information also about CAPI. About 80% of our clients are actually immigrants. 81.3% actually live at or below the federal poverty guideline. In 2022, we serve 293,000 plus pounds of food to families who actually access our food shelf. That amounted to 7,915 individuals served. The needs are there. Families are consistently coming to access our food shelf. We have stopped signing up new families just to ensure that we have enough food to serve the families that currently come to our food shelf. So the need is there. More and more families are becoming food insecure. We're hoping to increase capacity in the next couple of years, but this is CAPI and this is what we do. We love what we do. Our mission is actually to help underserved population, immigrants, and refugees who come to the Twin Cities. That's a little bit about CAPI and what we do. Thank you.
Anne, do you want to share a bit about Twin Cities Food Justice and a little bit about you?
I would love to. So I'm the executive director of Twin Cities Food Justice. The organization was started about 7 years ago by 5 graduate students at the University of Minnesota Department of Public Health, seeing the amount of food waste on one side and the increasing amount of food insecurity. So we are the link, the go-between between those two. We rely on about 100 volunteers that pick up about 20,000 pounds of food each month. And they pick it up from a food donor, a small co-op, a grocery store, directly from farmers or farmers markets, and then deliver it immediately to a food shelf, a pay-as-you-can restaurant, a community kitchen. We have no offices or warehouses or anything like that. We're small but mighty, have very little overhead, but I know that we truly make a difference. So our deliveries are also very close in proximity because we want to keep our carbon footprint small. So we're committed to improving health, particularly reducing the amount of racial inequity in terms of fresh produce and fresh bread, reducing waste, also reducing hunger and food insecurity. So we pick up fresh produce, like that picture. We're picking up produce that many of the bigger food banks and bigger food shelves aren't really set up to pick up because they take it back to their warehouse, then distribute it. Within a half an hour, we've got it from the pickup location directly to those who need it.
Thanks so much, Anne.
Mm-hmm.
Zach, I'll turn it over to you.
Hey, good morning, everyone. I am Zach Rodvold. I'm the Director of Public Affairs here at Second Harvest Heartland. I just started here in January, so I'm learning along with all of you, but I came to this work after 20 some years in state and federal government, public policy and advocacy work. Second Harvest Heartland is the 3rd largest food bank by output in the country. We're headquartered here in Brooklyn Park. actually moved to this location in March of 2020. And having come from a facility in Maplewood that was about a third of the size, this warehouse was intended to be grown into over the course of 10 or 15 years, but we are already operating at capacity given the pandemic and the impact that's had on food insecurity in our state. We serve 41 counties in Minnesota and another 18 counties in western Wisconsin. Within that service area, we have about over 1,500 program partners, food shelves, distribution sites. CAPI is included. We provide 94% of the food that's distributed in our service area. A lot of that comes through our warehouse. 30% of that, for the conversation about food waste and food rescue, about 30% of that comes from food rescue efforts. We work with all the large grocery chains in the state, or almost all of them, to take food that's still in good condition but nearing expiration, or maybe misshapen carrots, potatoes, things like that, and take it directly to the food shelves. So we are on track to distribute over 130 million pounds of food this year. About 30% of that comes from our food rescue effort, never comes through our warehouse. We also get food. Most of what we get is donated food. We have food from, and when I say donations, I don't mean food drives, but large, 30,000 pounds of frozen mac and cheese, for example, a few weeks ago. We're lucky to have some food partners headquartered in our state, Land O'Lakes and General Mills and folks like that, who provide us with a great deal of food that goes out into the emergency food system. We also, through the USDA, get food through the Emergency Food Assistance Program, the Commodity Supplemental Food Program, and other sources of federally funded food. All of that, 70% of that anyways, comes through our warehouse. Much of that is packed by our volunteers in our volunteer center. Some of you may have come in and volunteered. If you haven't, it's a great experience, and we welcome you anytime. From here, it goes out to our network of program partners who then serve our neighbors in need. We don't have a food shelf here at Second Harvest. We do provide senior nutrition boxes through the Commodity Supplemental Food Program that I mentioned earlier, serving a few hundred seniors every month. But for the most part, we are the distributor of food to a really big network in Minnesota and Wisconsin. And we work closely with the other food banks around the state in helping to ensure a lot of our food comes here first and then to them. So we sort of have a statewide reach, but work directly with those 1,500 program partners. So happy to be here and look forward to the conversation.
Thank you. I'm gonna stop sharing now. Thanks so much again for being here. And I mean, let's just, we've had a little bit of the issue set up. And then hearing from each of you, and what I love is that you each have, you play a variety of different roles within the food, within the system, within organizations that are working to address hunger in our state. And so I'd love to just start us at, we were looking at some of the stats around food shelf visits and just food insecurity numbers at the highest level, right? And I think what, I'm curious about when we're hearing from different things is in headlines is, why are we seeing those increases? And what is really driving some of that overall need and the increase in the need? Zach, do you want to maybe get us started?
Yeah, I said earlier, this is a good time to have this conversation. Food insecurity in Minnesota is at or above what we saw during the peak of the pandemic. And that's not something that many people are aware of. It might be surprising or counterintuitive, but it's reality. The number that Maggie shared earlier about food insecurity in the United States is the most, that was reported as of June. That was the most since December of 2020. We're seeing that trend here in Minnesota. We've been tracking food shelf visits on a month-to-month basis, and in May, total food shelf visits in the state were over 600,000. That's compared to about 530,000 a year ago and fewer than 400,000 2 years ago. And so it was in the news, you saw it in the paper, food shelf visits in 2022 were the highest ever. I mean, we had a big spike from 21 to 22, but what we're seeing in 2023 is actually even more need. And there's a number of factors that go into that. One is that the cost of food has increased significantly since 2020. Inflation overall is cooling off, but food prices aren't going down, and inflation has outpaced wage growth for most people. At the same time, during the pandemic, there was a lot of investment at the state and federal level in making sure that people could afford basic needs. And so we had the emergency SNAP benefits and pandemic assistance programs for housing and rental assistance, and you name it. All of that, for the most part, now has gone away. And so food insecurity rates were kept lower than they would have been during the pandemic through those programs and the federal child tax credit and other things, the stimulus checks, all of that helped keep people afloat. It's gone away. Wages haven't made up that difference. And so we're seeing a lot of people fall into this, fall below the line of being food insecure. And I will say one other thing, which is there was a article recently about how Walmart has become the state's top grocer. There are a lot of middle income families who are feeling stretched, who are feeling pinched too by the economic conditions. And so they're looking for ways to save money when they're buying food. And so if you can imagine at lower levels of income or lower levels of food access, how that would lead families to be food insecure. And so food shelves are seeing more and more people now who are relying primarily and sometimes exclusively on food shelves to eat, whereas during the pandemic, it was more of a supplemental assistance. And so the conditions are unfortunately going the wrong direction in our state, and we'll be talking a little bit more about what to do about that. But that's some of the factors behind what we're seeing right now.
Yeah, I think for me, just hearing about that reality of the COVID relief programs coming to an end is helpful to just recognize how the impact. Anne or John, anything that you feel like you're seeing in regards to this, or just that overall why and the increases?
Well, for us here at CAPI, we've seen almost similar things that Zach mentioned. Food inflation is impacting the clients that actually come and access our food shelf. $100 trip to the grocery store is like $50 nowadays. You could take $100, 2 years ago and get a whole cart of food. Now you take $100 to the grocery store, most likely you want to get a tray of food. That has impacted our clients. Their demand on the food shelf is so touching sometimes when we have to turn away clients. We have policies here now that we allow clients who are not enrolled in our program to receive food once every 6 months. So that is something that we just are not in the position to do, and we're struggling with as an organization. Food inflation is a major concern for our clients who come in on a daily basis. Another reason that's impacting our shelter, our food shelf, is also the closure of two major stores in North Minneapolis, Aldi and Walmart in Brooklyn Center, which is close to CAPI here in Brooklyn Center. It also limited the opportunity for affordable food for the families we serve. Families are coming on a daily basis to receive food. We see a hike in the number of families who are accessing the food shelf. And that's something that we want to confront as an organization, but there are challenges there. Lastly, unemployment and underemployment of some of the families that actually access our food shelf. They come in underemployed, not getting livable wages. The challenge is there, and they come to our food shelf for assistance. So those are some of the things we are seeing. Food insecurity is gradually increasing. We're seeing more and more families coming in on a daily basis to access our food shelf.
John, maybe you could keep going and kind of share a little bit more about how have the needs shifted of the clients that are coming in and working with CAPI since COVID? What's new or different in their needs over the past couple of years?
Yeah, it has shifted a lot. It has shifted a lot. With our food shelf is actually open 3 days a week. So we are open on Tuesdays, Wednesday, and Thursday. By the end of day on Wednesday, our food shelf is basically empty. So the families who are coming on Thursday don't have the opportunity and to access a variety of foods that we have in our food shelf. We've seen over the past year that families are coming in, especially new families, they are coming in for services. And what we've done over the last year is to limit the amount of foods that families can actually have when they come to our food shelf, just to make sure every family has an amount of food to take home. Another thing also is that the families who come to our food shelf can only come once a month. So imagine a family only coming once a month to get a cart of food, hoping that will last them for 30 days. Especially if you have a family of 4 or 5, the needs are ever increasing. So the challenges are there. The challenges are there. We've seen families coming, new families coming every day, wanting to access our food shelf. And that's concerning. That's concerning. How do we address this? One of the factors I mentioned before was the closure of Aldi and Walmart in our neighborhood. The greater question I want to pose for city leaders in the Minnesota Department of Health is that is North Minneapolis becoming a food desert, limiting the options for the families who live in that community? We have lots of clients from North Minneapolis, Brooklyn Park, Brooklyn Center, Hennepin County as a whole. So that's a challenge to us. And we see this on a daily basis, and we just don't have the capacity to serve all the families that are coming to our shelter for food on a daily basis.
Zach or Ann, what are you hearing from some of your partners as we're coming through COVID? How have needs shifted? What are the things that you're hearing, you're seeing in terms of need?
I think we're definitely seeing an increase. It's interesting. I was at a soup kitchen yesterday called Soup for You down on Franklin that provides, fresh soup 5 days a week to the community. And they're saying that they've seen a significant increase in older women coming. Most of the information that I receive, I go out and do food rescues all the time because I want to not only connect with our volunteers, the food donors, but I want to see what's going on and really meet the people that are receiving our food. And so I was interested. It's anecdotal. There is no statistics. But I thought it was very interesting, significant increase in immigrants who are hungry. As I said, at the soup kitchen, older women. Again, I was at a very small co-op. We tend to work with very small food shelves. CAPI is an amazing organization, and they're big. If they can't afford to stay open more than 3 days or have, once every 6 months to come and get food, think of the really small food shelves that are, I'm not kidding, mostly run out of church basements. They're meeting a neighborhood. It's very old, not great church basements, but they're really meeting the people who are hungry exactly where they are. And those are the ones that I'm seeing huge increases. There was the line for the food shelf in North Minneapolis called Camden Collective was 2 blocks long by the time they opened. And we allow these people to come and take, what they need. And they're open every Saturday. And they have access to good, fresh produce because we go, in their case, to a farmer's market and directly to a farm and take it specifically to that food shelf at no cost to them. If CAPI can't afford to buy food and to stay open longer, Camden Collective certainly can't. And so we then provide that food at absolutely no cost and deliver it and help serve.
Yeah, it's great to just hear the different roles that
Yes.
you each can play and how organizations are filling in, right, for some of the gaps or the capacity constraints. How have your programs shifted since COVID? What have you had to do internally to adjust? I mean, John, you talked about having to adjust, bringing in new families. What are there other things that you've seen or had to do from a programming standpoint? I'd love to hear from each of the groups about how your organizations have had to respond and what maybe new or different program adjustments or operational pieces have been put in place.
Well, I can share more. Let me just give you some numbers to reference what I'm about to say. Last year, all of last year, we served 7,915 individuals here at the food shelf for the entire year. This year, by the end of June 2023, we served 10,325 individuals. So that's an increase of almost 25% over what we served last year.
The first 6 months of the year.
6 months of the year. So that tells you the amount of folks who are coming and accessing our food shelf on an emergency basis. And also sometimes we have what we call Fresh Food Thursdays, where we have food and the public can actually come and receive food. So those families that normally are not registered in our program have an opportunity to come every other Thursday and get food. That's one of the new things we did with our programming. So for those families who are not allowed because we close our food shelf, they can come every other Thursday and get food. That was something we did to change our programming to accommodate some of the families and some of the numbers that we were seeing on a daily basis at our food shelf. We have Fresh Food Thursday. We also do deliveries to families who don't have access to transportation, because that's actually one of the causes of challenges to food access, transportation. We do deliveries, we take food to some of the families who don't have transportation or don't have any means of actually coming to CAPI to receive food. Those are some of the things we've done. And lastly, one of the things we've done to be creative also is to reduce the amount of foods we give to families, because that's a way of serving more families. When families come in, they have a whole pile, and say a family may take, 150 pounds of food or 50 pounds of food. We reduce that so that we can serve more families. So those are some of the things we did with our program to accommodate the numbers that are coming to our food shelf.
It's like families you're stretching.
Yes.
Yeah.
Yeah, and I can say, so food shelves within our service area, they have an online system they can go into and order exactly what they're looking for, what they need. I know there's a question in the chat about culturally connected and culturally relevant food, which we can talk about as a part of this, but we have seen just an enormous increase in requests for food. So last week, Wednesday, our warehouse team, our order selectors picked over 500,000 pounds of food in a single day to put on pallets, to load onto trucks, to go out the next morning to our program partners, which is far more than we would typically see on a regular day, such as they are lately. And for context, in the month of June, we did 9.8 million pounds of food total just for the month out of our warehouse. Our most ever was 10.1 million pounds in June of 2020. So it is, that's just like our programming we've had to staff add staff to the warehouse. We have had to reorganize and grow a little bit kind of across the operation to account for it. And we're building a public affairs and advocacy team here at Second Harvest Heartland, which is what I came here to do, to look at ways to address hunger, not through emergency food, but through policy and advocacy and going upstream to make sure there are fewer hungry people in the first place. But one program I'd like to just highlight, because I think it's really cool and interesting, is our Kitchen Coalition. It started during the pandemic as Minnesota Central Kitchen, kind of inspired by Jose Andres's World Central Kitchen, but we quickly realized that we didn't need to build a kitchen here. We have all these local independent restaurants around, especially around the Twin Cities, who at the time during the pandemic, of course, were either shut down or operating at very low staffing capacity. People were out of work. People couldn't go to restaurants. And so we tapped that network of restaurants to start. We would provide the food through our standard process to them to make freshly made meals. And then those prepared meals were sent straight out into the community. So for people who are either unhoused or couldn't cook for themselves for any reason, we started that program in 2020 and just hit the 4 million meals served mark through the Kitchen Coalition. And so it's a great network of restaurants and folks that are involved. They do provide as much as possible culturally connected foods to the communities that they're serving. It is a challenge in food banking to do that because we rely so much on donations that we don't have as much say as we would love to have when it comes to what is coming into our warehouse and then what we can send back into the community. And so maybe I'll save that conversation for a little bit later, Meg, if you want to get into it, but it's a challenge, but that Kitchen Coalition program has been one way to address that.
I would say that Twin Cities Food Justice has implemented a number of different programs with the goal of taking the food directly to where those people are hungry. So, for example, we just started right at the beginning of the pandemic, we started the Full Fridge Initiative, where we actually purchased refrigerators for facilities that are low-income housing or for those who have been living on the streets or coming from a place of addiction or just out of prison. And we have put a refrigerator into their community room, and we keep that stocked 24/7 with fresh produce and fresh bread. And they can access that whenever they want. So they don't have to deal with the stigma of going to a food shelf. They also don't have to figure out, how am I going to get there? And then how am I going to get all those groceries back home? So another example of getting the food to where the people are is that we provide, we have a little mini pop-up food shelf at a number of different kinds of organizations, such as free clinics. The People Center down at Cedar Riverside, we set up a pop-up food shelf there, and then the nutritionists at the clinic provide that food to the patients and explain, this is why you need to eat kale and this is how you make it so it doesn't taste nasty. We also do that at a number of different diabetic clinics. This is how you eat, and here's the food. We will give it to you. If you just tell someone who is living in poverty, who's suffering from high blood pressure and diabetes, they're not going to then go buy that food at a huge cost. But if we are able to give that to them and explain why it's important and explain how to prepare it, that makes a big difference. I was recently in one of those facilities, and one of the residents said to me that she had tears in her eyes, and she said, I have never in my life been able to control my high blood pressure, my diabetes, all my health issues until I had regular access to fresh produce. And she said, I've been without a home, I've been through addiction in my life, never ever have I had that access to fresh produce. And she said, look at me, she goes, have you ever tried to buy a green pepper for $2? And I'm like, we're honored to provide this at absolutely no cost. And, it really changes people's lives.
For that. I mean, and you hit on some of the sort of non-traditional or the ways that people have gotten creative. Zach, you talked about kitchen coalitions. Are there any other things that you're seeing or that you're doing around how to have non-traditional ways to address the issue? Creative solutions that you're seeing put into play that you'd want to share with the group?
I'd mention just one more is that I think is really interesting is we've started providing food to high schools. I'm thinking of one in particular, and they have social workers working at that high school, and they know on Fridays, many of the students go home and they're not going to have enough food for the weekend. So they will make a packet and then discreetly put it in their backpack to send that home. We've also had a huge increase in the number of food shelves that we provide food to, fresh produce to, at colleges. So we provide food to Hamlin, the U, Augsburg, St. Kate's, St. Thomas, St. Paul College. All of the students are not able to buy good food and really not able to buy much food at all. And so we've seen a huge increase in that area. And so it's interesting just to see all the different areas that are non-traditional that you wouldn't expect to see the need so great.
I might highlight a little bit because I think it dovetails with the question about where can sort of the philanthropic community best support food systems as well. We have been supporters of the Good Acre, which is a BIPOC owned and led kind of coalition of food producers. And so there's, by purchasing food at cost from the Good Acre or from other BIPOC owned businesses or producers, we're able to both allow for more people entering into that space. It's a hard place to get into, to get the capital, the equipment, everything you would need to become a farmer in the first place, the land. And so we're partnering with the Good Acre to get fresh produce, which then goes out to the network and also supports this community of BIPOC farmers. And the hope is that we can, we meaning all of us in this space in Minnesota, can support the scaling of efforts like that and invest in these sort of self-led or community-led initiatives. We had a roundtable here yesterday on tribal food sovereignty, and Sean Sherman was here, and we had other policy and community leaders working in that space. And there's just such a huge need for the tools and equipment and investment on the front end to allow communities to then, in this case, tribal nations, to produce their own food in a way that is culturally relevant and spiritually connected food, rather than, going back to the issue of if they're relying on food banks and food shelves, it may not be connected to their community. It may not be appropriate for an individual's health if they have chronic conditions. And that's another area where we're trying to get more involved in through our food as medicine work and food RX. But I think more investment in the community capacity to grow and produce food that is relevant and wanted by those communities is a great place to go upstream, and a little bit of a non-traditional way to think about emergency food relief.
Yeah, it makes me think about one of our registrants actually was asking about the connection to agriculture. So Zach, you talked a little bit about that, but I'd love, and I know you in our sort of pre-meetings were talking a little bit about some of the things that the discussions you're having, but maybe as a group, what are the ways that you're seeing that connection to the agricultural community in terms of addressing the issue?
I found that during the initial part of the pandemic that farmers, small farmers, saw an increase in the amount of produce. People were not going to grocery stores, so they would seek out these small farmers and buy food directly. But that has now slacked off. And the small farmers that we purchase food from, they are finding that this is their income. How do you plan for that? Because it's all over the place. So we're really passionate about supporting small farmers, and then particularly if they are growing culturally specific food, and then being the go-between between that farmer and then the food shelf or the whatever it is. So, for example, purchasing food from a farm, Wild Dreams Farm that grows indigenous food, and then we pick that up and we're the go-between and we deliver it directly to First Nations Kitchen in Minneapolis because they don't have access and it's expensive. We also have a relationship to purchase to get halal meat into the city. Also very expensive, but important if you're from that culture. So making that connection, again, we're just the go-between, the link between those, because a farmer has enough to do without driving the food in. And a food shelf doesn't have the time to go pick up the food. Again, so that connection, I think, is important.
Yeah, we, a couple things I'd say on this. One is we're in the middle of a farm bill renegotiation, reauthorization. This happens every 5 years. And so we're part of both a national and a state coalition to ensure that the farm bill maintains at a minimum the benefits available through the nutrition title. A lot of people don't know what is even in the farm bill. 80% of the farm bill this year is going to be federal nutrition programs, most of which funds SNAP, or what used to be called food stamps. And SNAP is the most effective hunger relief program that our country has. For every meal that comes through the charitable food bank system, SNAP provides 9 meals. And so hunger relief efforts are largely funded through the agriculture budget at the federal level. And as I said earlier, we get food through some federal programs that, federally funded food comes right into our warehouse and then back out to food shelves as well. We also, in this last legislative session, were seeking additional money for the state's farm to food shelf program, which basically pays for the transportation costs associated with us sending trucks out to farmers who have excess produce or food that would otherwise either be composted or go to waste. We go pick it up and take it straight to a food shelf. And so that is something that could easily be scaled up with additional resources. We made the case with the legislature. Unfortunately, didn't see much of an increase this last session, but there's always next year. And I think that is one way where we can partner directly with farmers. It's good for them. They're, we are solving a problem for farmers. In some cases, we're purchasing directly from farmers, and then connecting that food back with the people who need it the most. So we've got a lot of ways in which we partner with the state's agriculture community. And there's a question in there about rural hunger. There's sort of an irony that where the food is produced, there are also the highest rates of hunger. And so we have both in the state a racial hunger divide and a geographic one. People in greater Minnesota have rates of food insecurity that are higher than the statewide average. SNAP participation rates are higher in rural counties than they are in suburban and urban ones. SNAP, over half of the state's SNAP program participants are in greater Minnesota, even though that accounts for less than half of the state's population. And so there is this is a statewide issue, and hunger is prevalent in communities across greater Minnesota. And we're going to be making a kind of a big deal about that as part of this farm bill negotiation process, because we have some folks who represent rural communities who view SNAP as who want to weaken it, who want to add further work requirements or time limits or kick people off or decrease funding for it, none of which will help, obviously, with food insecurity. And this is the worst possible time to be doing something like that. And the communities across the state in rural Minnesota are disproportionately impacted when we make changes or cuts to SNAP. And I don't know that the challenges with hunger are any different than anywhere else. It's happening for the same reasons. There are also, as John mentioned, transportation. If you live in a community that's 40 miles from the nearest grocery store and you're a senior on fixed income, you can see how hard it could be to get food. And so one other thing that we're doing, and I'll end on this, is we've created a map of food insecurity in the state overlaid where our food shelves are and where emergency food programs exist. And there's not always alignment there. In some parts of the state with the highest rates of food insecurity out in greater Minnesota, they have the least access to an emergency food program. Now, that's not the answer. We don't want more people to have to rely on the emergency food system, but in the short term, at least that access would help. And then we can think about the longer term solutions to ensure that they don't have to rely on it in the first place.
John, you came off mute. Was there something you wanted to
Yeah.
share? I just wanted to.
Just something additional. I think for us here at CAPI, our challenge is securing additional resources for the purchase of culturally acceptable food.
Yeah.
We have 80% of our clients being immigrants and refugees. So that's an extra challenge to us as an organization because culturally sensitive food are expensive. So we consistently have to make that purchase. For the last couple of years, the food shelf has been actually over budget every year because we just don't have enough money to keep up with the demands and the purchase of culturally sensitive food for the clients we serve. So that's a big challenge, securing dollars to make sure that we can actually buy the food and provide it free of charge to the clients who come for food at our food shelves. That's a major challenge that we're having right now.
Yeah, I mean, we've talked a little bit, but I seeing it in the chat, and I'd love to hear just how each of your organizations or what you're seeing with other organizations in terms of ways to make that possible. How are you addressing the need for culturally relevant foods in the different populations that we're seeing that are facing hunger?
I think we're addressing that by going directly to the farmer, and as close to the farmer as we can get. That's 100% correct. It's very expensive, and it's also hard to come by. And so if we can pick it up and take it to a food shelf at no cost to the food shelf, I'm very conscious. I hear all the time about how much money food shelves have to spend to buy the food that they give away. And that's why I think that there's a significant need for food to be donated. By the same token, we need to pay the farmer. The farmer's not, can't donate it to us. So we're able to raise the money to pay the farmer a fair wage and then take that directly in and give it to the food shelves at no cost. And then they in turn can give it to the people who need it so much at no cost. So we do that. We do that in a number of different, some of them I've already mentioned. We also work with a number of Latino farmers and take in to tomatillos and corn and tortillas to organizations in both St. Paul, Minneapolis, and the surrounding area.
And also, I think another challenge here is that in Minnesota, because of our weather here in Minnesota, local farmers are actually challenged in terms of the time they have to grow and harvest food. So one of the initiatives that we're taking as an organization is to have grain hubs, set up a greenhouse is part of one of our future projects. We are in the process of actually kicking off a capital campaign. That capital campaign is to raise some money to erect a new facility that will have a greenhouse and that will have urban gardens where folks from the community can come and actually plant some of the food that they enjoy. That way we can make sure that we have a direct stream of culturally acceptable food for the clients we serve. So that has been a challenge. How do we have this consistent flow of culturally acceptable food when in fact, farmers in Minnesota probably have maybe 4 or 5 months compared to other farmers in Texas or down south that have about 9 to 12 months to do farming. So that's a bigger challenge here in Minnesota.
Yeah, this is an area where we definitely want to do better. We, we hear from our food shelf partners who are serving specific communities with specific cultural food needs. When they're coming to us and asking for something that we don't have regularly, we know that we need to find it. And as Ann said, it is hard to find producers that have excess food available to come into the emergency food system in the first place. What we do find, we almost always have to purchase. Most of the food that we send out to our network is at no cost. Food that we purchase, we pass along at cost, except for, in this case, for culturally relevant, culturally connected foods, we do it at half the cost, because cost is such a factor in this, and it's hard for us, the Second Harvest Heartland, to afford. It's certainly hard for food shelves operating on shoestring budgets to afford. And so we've done our part as much as we can right now by reducing the cost of those culturally connected foods. But I think going back to what I said earlier, and the sort of point of our roundtable yesterday on food sovereignty is Dream of Wild Health, the organization that Ann mentioned that they work with. They just tripled the size of their farm up in the sort of northwestern exurbs, Hugo, from 10 acres to 30 acres. And the cost of land is enormous. But imagine if they had 100 or 200 or 1,000 acres to be growing indigenous foods, traditional indigenous foods that could then go back out into the tribal nations around the state. That is a significant investment. That would require a significant investment on their part that they can't do on their own. But we and others can support them in that and get to the point where there is enough culturally connected food being produced that it is either making its way into the community and is accessible, or folks like us are able to source it, either purchase it or get it donated, and then send it to the communities where it's needed the most. So we can do better. We want to do better, and it's hard.
Yeah. So I kind of want to hit on, because a lot of the questions are around like, what can we do, right? What can philanthropy do? And I'd love to hit, because Zach, you also talked about legislation, and we saw a lot of legislation around food this past session. And so let's talk first there, and then let's shift into the philanthropy space. But I'd love to hear, when we think about the legislation that passed around free school meals, emergency funding for food shelves, what's the impact been? And where do we need to be looking at next?
Yeah, well, the biggest ticket item that passed as relates to hunger in Minnesota was the Universal School Meals bill, the new law, which we supported. We were part of that coalition. It just ensures that every kid during the school year gets a healthy, at least access to 2 healthy meals a day. And that's for a lot of families, that is keeping them from becoming food insecure. I think we saw when during the pandemic, we had universal school meals nationwide, and the states that ended that, the data showed almost immediately an increase in food insecurity. And like, I think a third of families or something, according to the USDA study, right after those programs, or the beginning of the school year after the program ended, a third of families are having trouble meeting basic needs. So that's going to be huge, I think, for the state, but it is only one piece of a very complicated puzzle. A couple other things I would just highlight, because hunger is not a problem by itself. It's connected to poverty, and poverty itself is a policy choice, I would say, that we have made and we can choose to address. So the state-funded child tax credit, for example, is going to make a big difference, getting money into families' budgets to be able to afford basic needs. The $1 billion that was invested in affordable housing and rental assistance is going to help keep people from becoming food insecure, because the cost of housing and the cost of food are so connected to poverty and food insecurity. So that will help. The paid family medical leave will help more people work and earn a living and not have to rely on the emergency food system for food. So things that seemingly aren't even really connected it's all connected. The money that passed for food shelves, I think, was $5 million, and then additional, I think, $7 million for capital improvements. That will help. That doesn't go to all food shelves in the state. And for the ones that are receiving it, it's largely filling holes left by the pandemic. So we didn't invest a lot in the future of the emergency food system in the state through this last legislative session, even though there were some really good things that were done. So going forward, we want to make sure that the entire system is funded adequately, from food banks to food shelves and program partners. And so we'll have some ideas of how to do that. We want to address take-up rates. There are a lot of people who are eligible for public assistance programs who don't receive them. And there's a lot of reasons why that is, but one of them is how hard it is to apply and how many hoops we make people jump through to get assistance. So we want to talk about lowering that administrative burden on folks. We want to talk more about food rescue, and food waste is a big piece of this puzzle here. We have the food, it just needs to get to the right place. We need to do a better job of that. But in general, there's kind of a national shift in thinking happening, and we're, I think, reflecting that in how we're seeing this of, our mission is to end hunger. We're not going to end hunger through charity. We can get people food when they need it in the moment, but that doesn't help anyone become economically sufficient and stable and safe and fed. And so we want to look more at policies that are kind of in the root cause space. Why are people hungry in the first place? Why are people poor in the first place? These are policy choices that we've made, and we can make different ones. And that's a conversation that we want to be a part of and help lead in Minnesota. We hope a legislature who will work with us in that to that end, and we want to set some big ambitious goals and work with everyone here and a lot of people around the state to achieve them.
That's great. Ann or John, anything? I mean, John, when I just think about some of the impact, is there anything from a CAPI standpoint that you're feeling? But does that idea of the funding that came through is really filling holes resonate with you?
Yes, it does. Yes, it does. I mean, like I mentioned before, our food shelf has been over budget for the last couple of years. Finding the funding to actually maintain the food shelf, buy food to give to families, buy cultural sensitive food is a challenge. It's a challenge. So any opportunity to tap into resources, Hennepin County is a great resource. Second Harvest, we buy food from Second Harvest at cost, and we give that food to the families we serve, but it's just not enough. It's just not enough. The demand is high. We just don't have capacity as an organization, so we're just caught in the middle. That's why, I mentioned before that we're looking to expand. In the future, our food shelf will probably be 3 times the size of what we have now. So you can imagine how much clients will probably be serving in the next 2 years or so. So, resources, where can we find those resources to increase our capacity at this time? That's the challenge.
So we're going to move. I mean, we've been trying to incorporate some of the chat questions into the conversation, but we'll move a little bit more directly to some of those questions. And Bill posed one just really about how, would love to hear the 3 of you talk about just how is the cost of goods, inflation, impacting your organization's ability to operate, and how much are you spending, roughly, or just what does that look like in your org, the impact to you in terms of operating, and what philanthropy can do to support you in that?
I think our story is going to be a lot different than others in that we're a very small organization. We don't have much overhead. The food that we procure is largely donated, and we give it at no cost to food shelves. And I have heard that really makes a difference. A small food shelf we serve in the Uptown area spend really small. It's in a house. They spend $180,000 buying food to give away. last year. So our ability to continue and expand giving food at no cost to food shelves really makes a difference. We have overhead. We have individual donors. We don't get big government grants or big corporate grants. But, you know, it really, the donors that support us, that generosity truly makes a huge difference for us. And it allows us to keep doing what we do and supporting the volunteers that we do.
The Second Harvest perspective, it's a good question because we are dealing with the same challenge at a kind of network level. So we have had to purchase more food. We're getting less food from the government now than we did during the pandemic because, again, many of those programs were temporary and have ended. And so as we get less from the federal government, with no additional investments being made in the last state legislative session, we're having to purchase more food, and the food that we're purchasing is more expensive. It's the same at our level as it is at a family or individual level. And so that is eating up a bigger and bigger share of our total budget, which means we're not able to do the other, we're not able to do the rest of what we would want to be doing, or giving, sending food along at lower costs, because it would be unsustainable from a budget standpoint. And so, all of it is, we have grown as an organization, added a lot of folks, including to our warehouse team, to meet the demands that we're experiencing. So the cost of labor, to the question, the cost of labor has gone up, the cost of purchasing food has gone up, and our response to that right now is just trying to raise more money. We just need to have more money available so that we can continue to do this. I don't think even we expected that we would be operating at this level for this long. And the reality is right now, it's not leveling off, it's not going down, it's going up. And so we are going to continue under Allison, our CEO's leadership, here to just raise as much money as we can to meet the need in the moment, but understand that that's not sustainable forever, and it's not the answer to the bigger problem that we have here. So it's kind of both things, but it has made it a challenge.
I think it's the same for CAPI. Looking at our budgets and looking at the demand, the ability to purchase food with the same amount of money we had last year is far less here in 2023. So, those additional dollars will definitely benefit and expand our mission here. It's a challenge. It's a challenge all over. The increase of families coming, the demands. Like I said again, over the last 2-3 years, the food shelf has been over budget. Every year we're over budget because of the demand. We just can't handle. And I'm not sure when this is going to stop or when it's going to level out, but the challenge is there. We budget a certain amount based on our organization finances, and we're hoping that, hey, 2023 will be better, but it's just the same. Just the same. We have to buy more food. We have to spend more dollars, and just be smart with the dollars we're getting so that we can serve the families that actually come to our food shelf. So that's a challenge. It's over the last 2 to 3 years.
There's another question really about, so it says, my question, reflecting on your experience of efforts to combat food insecurity, whether that be as a professional in these systems or your personal life, are there any social crises that helped amplify food security when they were aligned? Is that environmental issues, wellness, education, public policy, or public safety?
I don't know if this gets exactly to the question, but we do know that the pandemic laid bare a lot of the problems that we have both with food chains or supply chains for food, access to food, and it showed how vulnerable so many people are in our country. I mean, it's not like it wasn't a problem pre-pandemic. It was maybe just hidden a little bit better from people's view. And so as we saw during the pandemic, those investments in people through money into families' pockets made the biggest difference in food insecurity. And so I would say economic security and food insecurity they go hand in hand. hunger, as I said earlier, is an extension of poverty. Poverty is an extension of policy choices that we've made in this country. And so I think we need to not view it as an individual stroke of bad luck or something like that. It's more systemic in nature. And so all of those, everything asked in that question, all of these things do tie together. But from our perspective, the housing and food are the two most closely connected. When people are either if they're housing insecure or food insecure, they have worse health outcomes, worse educational outcomes, and these things cascade in a really dangerous and unfortunate way. So they're all connected, but I would put housing and food together as the two sort of twins of what we need to address.
John, I know you're. Oh,
go ahead.
Sorry, go ahead, Ann.
I would agree with that in that I think that all development activities, all activities to improve someone's lives are built upon the foundation of food security. If a mom doesn't know where she's going to find her next meal for her kids, she's not going to be able to start classes or do English as a second language or whatever those, go find a job. She can't do that because her concern is my kids are hungry. So we've seen the biggest impact where we partner with organizations that are providing those next steps. And that's really the transition for people when they know, oh, I know I have food. I can go to this food shelf. There's a food kitchen here. There's a pay as you can. We work with a pay as you can food truck that goes out within the community, hands out meals based on the food we deliver. Then that's when the transformation begins, when they know they can count on that food and then say, okay, now I can take the next step.
So I'm going to keep going on some of the questions that are coming through. And for all of you out there, make sure that you're dropping them in, and we'll kind of move through this in the next 10 to 15 minutes. So Sheila asked the question, can you share your thoughts regarding opportunity to extend shelf life of food through legislative efforts, remove expiration dates for specific food categories?
Yeah, that's absolutely a part of what we're looking at for our legislative agenda next year when it comes to food waste. This is especially a problem with eggs, as it turns out. The expiration date on eggs rarely matches the true expiration date, and so we are throwing away a lot of eggs, and imagine all that goes into producing the eggs in the first place. And it's also one of the most in-demand items from our network of food shelves. Dairy, eggs, produce, meat regularly, those are the things that are the hardest to come by. And so I do think there is more to be done there. I'm not an expert in this space yet, but let's reconvene next year and maybe I'll know a lot more. But that is, I think, a part of the answer when it comes to our food waste problem.
All right, I'm going to move. And Amy, you tell me if I missed any from earlier, because I know folks were dropping stuff in and I wasn't necessarily looking. So, but Brett and Kathy are asking, what organizations in Minnesota are the most involved in affecting food security policies statewide or nationally? I know CAPI works on policy and Second Harvest Heartland, but maybe that you could share your work, but also other organizations that you know of or that you're partnering with.
Our national affiliate is Feeding America, so we're a member of the Feeding America network of food banks. I think there are members in every state and territory. So at the national level, they're sort of the leaders on. They, along with the food research FRAC, I can never remember too many acronyms in this business, but Food Research Action Council, something like that. At the national level, Hunger, Feeding America, and FRAC are the two main ones. Here in Minnesota, Hunger Solutions has been around for a long time, does great work. They led the Universal School Meals campaign. They are administer grants for food shelves in the state, and so we work closely with them. Second Harvest hasn't traditionally been an advocacy organization, but that's changing. That's why I'm here. That's why we're building out a team here, and we're more committed than ever to bringing our resources to the table to change policy to help end hunger, which again is our mission. So those are a few that come to mind. And of course, there's a lot of great organizations, Twin Cities Food Justice. I mean, there's so many organizations that are out there filling the gaps that are left by Second Harvest or Feeding America or some of the other bigger operators in the state. Too many to mention maybe, but those are the big ones.
Any other partners you're working with, John, specifically that you'd want to highlight?
No, not necessarily, Maggie. We
Yeah,
do
that's
have
okay.
we do have a civic engagement and public policy department that's responsible for that. They actually network with other organizations and network with lawmakers to actually effect policies that affect food policies and how we serve our clients here at CAPI. So we do have an organization who is going out there, networking with lawmakers and making sure policies are put in place to impact food here in Minnesota.
All right, I'm going to go back. There was this one, I think I'll hit on this as a couple of different ways, but from each of you, would love to just see if there's, kind of any final thoughts on folks that are new to the issue in Minnesota, new to learning about food insecurity here. What would you want them to take away? And then what would you like to see philanthropy really stepping in and doing to help support in this time? Anne, do you want to maybe kick us off?
I sure can. I think that, as I echo what Zach said about this being a very multifaceted issue, it touches on equity, on racial equity, the fact that Black Minnesotans are 4 times more likely to be living in hunger than white Minnesotans is just simply not okay. That it's a huge climate issue. The amount of food that's thrown away is a tremendous. The amount of food that ends up in our landfills really has a huge impact on climate change. It's a community issue. So many of our partners are dedicated to building community, whether that's geographical community, cultural community. It's very important to them to build that community. Particularly, I'm thinking of a number of organizations in Minneapolis that lived through not only the pandemic, but also the unrest, and are there still today, very proudly building that community and serving the people there. So I guess my final thoughts would be that I believe that philanthropy, that donors should personally know, and the organizations that they're supporting, that they should know the impact of their generosity. And so I would say that, please come on a food rescue with me. You will instantly understand the issue. You will instantly get how important it is that we support food equity and the provision of fresh produce and fresh bread and nutrition across the board to all communities within the Twin Cities area and larger Minnesota. I'd take anybody on a food rescue. You need to come with me and go to a farm, go to a farmer's market. Pick up 500 pounds of food with us in your back of your car and just see the faces of the people, maybe often not English speakers, but that are so grateful. Just give us hugs to know that they can have access to this really good, nutritious food.
What about you, John or Zach? Just what else would you want to know? Are there any other or share any other sort of final thoughts around folks newer to the issue here in Minnesota, and then what you hope folks can step into from a philanthropy standpoint?
Sure. I think for us here at CAPI, I think what we want individuals to know is that food access is something that can be minimized. We can all get together and put in place policies that affect our communities, especially communities of color and underserved communities, which is a majority of the folks that we serve. Folks who are underemployed, folks who are unemployed. There are policies and there are support needed to help these individuals get to another level. And I think it is upon us to provide those resources, because if you look at the health system, for instance, 70% of death in the US is caused by chronic diseases. Chronic diseases come about when people eat unhealthy. Heart diseases, diabetes are all causes of eating unhealthy. So the more people we have not eating healthy, the more strain on our health system and the community as a whole. So my take on this is we can all help. We can all help in some way, giving dollars towards this effort, influencing our lawmakers to effect policies that will stream dollars to food shelves and food banks so that we can actually provide more to the folks we serve. We're not sure how long this is going to last. It may last for another 2-3 years, but we're hoping that at least we can do our part to help some of the families. Every day, I go to the experience of seeing the families sit in the lobby, getting food every day. I see them once a month and sometimes twice a month. And I see the kids walk up, 3-4 kids come in, and I see the amount of food that family is getting from CAPI. Sometimes families have to go to multiple shelters to get enough food to last them for at least a week. So the challenge is there to philanthropy and to individuals to give towards this effort and call the lawmakers so that we can have policies in place to make sure that we can at least reduce the amount of hardship and challenges caused by food access in Minnesota. Thank you.
Yeah, I think that's well said, and I agree with both John and Ann. A great way to get more involved in this is to go volunteer at a food shelf, spend some time in a community that's experiencing food insecurity and get to know some of the folks and understand their life stories and experiences. We just a couple of weeks ago, we were out in North Minneapolis every day for a week trying to promote the need to have more people volunteer there, given the specifically bad conditions with closing, as John mentioned earlier, of the Aldi and Walmart, and it's really both heartbreaking and heartwarming to see what's happening in the community. I would say a couple of things. One is hunger is a solvable problem. It is not something that cannot be solved. We are a country and a state with considerable resources. We have the food, as we've talked about. The food it's not a problem of not having enough food being produced, and so this is solvable. We just need to have the political will to do it, and that comes from all of us. It's on all of us to push our lawmakers in that direction, and so I would say it's not an either or, but a both in terms of we need to be able to serve people now. We don't want more people going hungry, so we don't want to divert resources that are helping keep people fed in this moment. But we also don't want to have any more moments like this. We want to address hunger at its root causes and minimize the role of the emergency food system in helping people stay fed. I mean, ultimately, I would love if we didn't need a second Harvest Heartland. If we could work ourselves out of a job, that's the goal. But as long as there's need in the community, we're going to do everything we can to address it. And so I would encourage folks to look at investments in organizations that are doing that policy work, that have a big picture understanding of the problem and are doing something about it and are being effective in that work.
Thank you, all three of you. Thank you, everybody. I'm going to just put up, so we talked about what are some ways to support? And I think the biggest thing that I heard each of you share is resources for this moment, but also volunteering. And so all three of these organizations have volunteer opportunities available right now. And so, I mean, who doesn't want to be called a food rescuer? I kind of like loved that title personally. I was like, I want to be a food rescuer. So feel free to head out to look at volunteer opportunities, but also to look at ways to donate.